the PAHO Virtual Campus established an interprogrammatic governance mechanism involving all managers in the organization to identify gaps, set priorities, establish quality criteria, and propose funding sources and strategies to promote the sustainability of the campus, which is so important. Now, in 2024, we are ready to take one more important step in the development of the campus. That is establishing an agreement for collective action with the WHO Academy. The agreement with the WHO Academy will improve health workers' access to qualified training courses organized through the WHO Academy platform. We will work collectively with the Academy on course design and follow-up, as well as the consolidation of technological and pedagogical models, the maintenance of updated technical resources, the adaptation of WHO courses to the cultural context of the Americas, and the continued development of the country campus nodes. Over the past 10 years, we have shown the power of a virtual educational platform in public health and its importance in advancing public health goals in the Americas. We are so pleased with this partnership and with the support of the WHO Academy. We look forward to continuing the expansion and growth of the PAHO Virtual Campus for Public Health in the Americas to strengthen the training of our health workforce and improve the health and well-being of persons in the region of the Americas. Thank you so much for your attention. Looking forward to the rest of the webinar. Thank you.
Thank you very much, Dr. C.D. Thomas, for your regional outlook of virtual education. Our next presentation will be by Dr. David Achuarena, Executive Director of the WHO Academy, who will talk to us about the Academy's vision regarding learning throughout life for a healthier world. Dr. Achuarena, you have the floor.
Thank you, Assistant Director Rhonda Sile-Thomas, distinguished delegates, dear colleagues. First of all, I would like to say that it's a pleasure to be a part of this webinar, presenting and celebrating this collaboration framework between the PAHO Virtual Campus and the newly established WHO Academy. The WHO Academy, as you know, will be celebrating its establishment. I mean, the opening will actually take place in 1 week on the 17th of December. And it was really established to take stock of the recent changes and challenges in public health, in terms of new developments regarding NCDs, but also the continuous threat of infectious diseases, as well as the impact of climate change and AMR on the training needs for the health workforce. The WHO Academy really intends to leverage all the, I would say, most recent development in the field of lifelong learning to put them really at the service of the health sector. This means really moving towards establishing a truly continuum in lifelong learning for health workforce, to develop individualized approach in the content and in the access to training, and to facilitate the articulation of offerings between different institutions. It's important to note and to recall that the establishment of the Academy is actually part of a broader initiative, which is the so-called transformation agenda of the Director General of WHO, to make the organization more responsive, more effective, more efficient, and better shaped to actually address and support member states in the provision of health for all. When the transformation agenda was initiated, WHO conducted consultation with member states to identify the most pressing needs. And indeed, capacity building and training emerge as a top priority for member states. And the establishment of the academy reflects actually the outcome of this consultation and the intention of WHO to really place capacity building and training at the core of its mandate and of its activities. As I said, the official opening of the Lyon campus in France of the WHO Academy will take place next week on the 17th of December, and this will also be the official launch of our online offerings. A few words about really our vision, mission, and strategic objectives. The vision is really to provide skills and competencies for all, health workers. I mean, that's really a global mandate, but with a particular focus on low-income countries. The mission is to achieve this vision is actually to develop not only content, but also to build a lifelong learning ecosystem. So to actually develop this network of institutions across regions. The goal, the strategic goal is unique. It's really to enhance and develop learning opportunities for health and care workers globally. So it's a very focused, I would say, strategic objective, which is declined in five dimensions. First, to provide innovative learning content. Two, to provide high quality courses. So the first two objectives relate really to the, I would say, pedagogy. The third objective is to build this global learning ecosystem. We also have a very important piece of work related to quality and quality standards. This is our fourth strategic objective, to develop a quality framework for our offerings, but also more broadly for WHO work in training. And finally, also, our objective is to foster a culture of lifelong learning within WHO. The WHO Academy is also an academy for the staff of the organization. The target learners comprise different groups, but the top priority for us is to provide the learning opportunities to health and care workers. That's really the major objective for us. We will also develop activities and content for decision makers, since it's important also to improve the formulation and the implementation of public policies. We intend also to develop capacity building content and initiatives to strengthen national institutes, but provide training for the health sector at national level. Finally, we will also have initiatives in support of national efforts to promote health education for the public in general, considering that prevention is also a key element for achieving health for all. And finally, as I said, we will also develop activities, and this is already the case for our colleagues within the organization. Training delivery will actually combine different formats. I mean, first of all, self-paced learning through online provision, that will be the major form of delivery. But we will also have blended courses. Actually, we already conducted a number of courses through that model. And we will, in terms of innovation, also mobilize and promote the use of game-based learning and the use of simulation. I will return to that when I will describe the facilities in the WHO Lyon campus. Now, the courses will actually combine different resources. First of all, the courses developed by the Academy itself, but also other courses provided by WHO. So we work with our teams and colleagues in Geneva, which also will make the courses available on the Academy platform. And we are also offering access to the platform to partner organizations, either to host courses on our platform or to actually develop what we call a gateway between our platform and the platform of partner institutions. So in other words, we'll be really offering a wide landscape of courses, not only including courses by the academy, but also giving access to a much broader menu of programs. I mentioned quality assurance as being one of the strategic objectives of the academy. We have already established 18 quality standards that are meant to guide not only the design of courses, but also the delivery and the assessment and recognition of learning outcomes. So that's a very important element of our work, since this quality framework will also be offered to other entities within WHO and beyond among partner institutions. Localization is a point that is important to actually highlight. Of course, the courses that are being developed and provided on the platform are meant to be open for all, I would say, countries and health workers in all countries. We will have a dedicated effort and mechanism to localize actually content, not only in terms of languages. We already have the platform available in 25 languages, but also in terms of content. And I'm sure that this will, for instance, be very useful in the PAHO region in terms of, for instance, of meeting the needs, but also leveraging the knowledge of the indigenous population. Just a quick word on the technology. We heard that the experience of PAHO with the virtual campus, which is already a well-established institutions with more than 20 years now of experience. The WHO Academy is a newborn baby, and of course we will very much learn also from all the experience and build upon the achievements of the PAHO virtual campus. We have developed a learning experience platform, so it's a WHO platform that will be launched next week, and that will not only be a depository of courses, but it will be also an active tool to actually facilitate and support the engagement of learners and to guide them through their learning journey. So to do that, we have been integrating already AI enhanced tools, and this is something that we are going to further develop in the months to come. Finally, a word on the campus, again, that will be inaugurated next week. It's a very, I would say, rich facility, more than 20 training rooms, 2 distance training rooms. And I'd like maybe to stress the fact that in the basement, we have developed a simulation center that will, using all the, I would say, advanced technology to be able to train not only health workers, but also decision makers to actually better respond to health crisis. So this is something that we're going to demonstrate, I think, for the first time, in fact, next week. So to conclude, I would just like to stress the fact that although we are based in Lyon, the Academy of WHO is, of course, an academy for member states, in their entirety. So it's an institution open to the world. And to do that, we will, of course, need to develop partnerships with key institutions in member states and close collaboration with our regional officers, in particular, as we are describing today with PAHO for the Americas. Thank you very much.
Thank you very much, Dr. Arena, for this important concept on education throughout a lifetime. and to talk about the objectives and the important educational aspects of the academy. We've heard strength and the institutional involvement that the Pan American Health Organization as well as the World Health Organization have regarding health workers education. Now it's time for the head of the Public Health Virtual Campus Program, Mr. Litowski, who's going to talk to us about the campus work in recent weeks. Gabriel, you have the floor. And he's muted. Good morning to all. We lost your presentation. There you go. Good morning to all of you. Special greetings from the city of Brasilia in Brazil, where I am at this time. I would like to thank Dr. Rhonda Seeley Thomas's word, the Assistant Director of the Pan American Health Organization, as well as the opening remarks of Dr. James Fitzgerald, speaking of our campus, and also our special gratitude to Dr. David Achorena and all the WHO Academy team for this opportunity to share this launching that the WHO Academy is doing with work that we're involving ourselves in. Very quickly, to reinforce the mission of our virtual campus as a collaborative effort among member states and other partners of the academy and institutions working in the region of the Americas, promoting training and development of competencies among the human resource in health in the region. The virtual campus is a public good working in lifelong learning. All our educational resources are open, interoperable, following the UNESCO perspective. We have a broad field of articulation with the global WHO Academy, and we're daily betting on collaborative and sustainable work. The virtual campus of the organization since 2020 has had institutional governance chaired by our assistant director with the participation of all the directors of the organization, offering guidance, directionality, thoughts on interprogrammatic work, and a strong focus on the training needs of our country. In this field of governance, we've already had 216 proposals approved, and it guides us and coordinates the everyday work at the virtual campus. As Dr. Fitzgerald mentioned, by December of 2024, the campus has already 3 million users enrolled in more than 7,000 million courses. All the colleagues who have been to the campus looked for others. The primary healthcare physicians and nurses are an important number of persons in the campus, but also important growth among technicians and students in all areas. In 2024, we've exceeded the number of new colleagues visiting the campus compared to 2023 or 2022, exceeding the worst moments of the virtuality at the time of the pandemic. All of this with a strong focus on the training needs in the smaller countries, in the priority countries of our region, special attention given to the language differences as well as the cultural differences in our region. This is an example from Colombia, from whom we'll hear in a few minutes, to reinforce the fact that our work is linked totally to services, focusing, as you see here, that in Colombia, we're working on geo-referencing the campus user in the municipality he works in and with better health where he's working, so that one can quickly offer harmonization between training and health services. Our work in the countries, as we said, is of a priority nature, considering the needs of each country. So here from Colombia, from El Salvador and from Chile, who are going to talk to us about some of the working models and examples of the excellent work that we've been having, the different agreements we've signed recently. In fact, we signed a new agreement with Peru, and every day more and more are joining. All this within the framework of the educational approach of the campus, which prioritizes harmonization between the work and educational problems on site of the adults in the work site, the adult resolving the realities of the work, and in the lifelong learning perspective, where there's going to be a lot of harmonization with the WHO Academy. They spoke of the learning pathways, and we're working on 4 here in our virtual campus: primary health care, better care initiatives for non-communicable diseases, regulatory authorities of medications and technologies, and digital health. A lot of joint work, hoping that the training itinerary will give the participant an overview with micro-referencing, focusing on competencies in their work site. And I'll end by showing the samples of campus certificates with the signature of our director and the digital badges so that our colleagues can share. We have 3 institutions in the region that we're working with now, strengthening teaching competencies, improving instructional design, and strategic data analysis for decision making. Thank you very much. And Isabella, back to you.
Gracias, Gabriel, por esta visión rápida y abarcativa de la trayectoria del campus y de las últimas novedades.
Very succinct overview, and also for giving us updates on many of these initiatives. Currently, well, now we've invited some representatives from the member states in the region and our country offices. So we're going to hear some experiences from Chile, Colombia, and El Salvador. So we'd like to thank the country offices and government officials from Chile, Colombia for the efforts undertaken. So let's begin with the Vice Minister of Social Projections from Colombia, Dr. Luis Macices Arariaga. We can start off with the video as an introduction. Good morning. Special greetings to everyone on behalf of the Ministry of Health and Social Protection in Colombia. We're going to discuss the Colombian healthcare system training and looking at the key focus. What is the central role in terms of developing human talent? This is a key question that comes to mind. What do you consider are the essential factors in order to manage this series of changes? Well, this, I think, slide summarizes the entire challenge that the country is dealing with, and actually it goes back several decades. Today, we see this window of opportunity with a progressive government that is providing us with a possibility in making greater strides in these fundamental efforts to preserve our right to health care. So we're looking at our main focus area is to provide the public protection as well as a unique, universal, efficient, and solidarity healthcare, ensuring that right. So we're going from the current healthcare system to a new social security system. The current one is based on individual insurance, and governments, well, in this case, the government uses payroll taxes and other taxes that include funding for paying for these premiums, healthcare and health insurance premiums. So, of course, there are multiple barriers to access with this system. We have an emphasis, mainly in hospital emergency care. This is based between competition among various healthcare providers. It's segmented based on the capacity to pay by patients with multiple barriers to access to healthcare. So now we're going to transition to this new system, which is individual, family, and community-based healthcare, working with economic and social determinants. And the cycle of care is based on cooperation amongst the various stakeholders. We have these networks, integrated networks among various healthcare jurisdictions, so that we can ultimately ensure universal healthcare coverage. So this is the transition phase that we have seen over the last 3 decades. We've seen a separation of many of our workforce in having coverage. We've seen a systematic exposure and vulnerability. So for many, working with the Pan American Health Organization, we have established over the last 2 years a new transition plan that has been reinforced thanks to the efforts of various stakeholders to deconflict a lot of the healthcare access flows. We delegated, well, many of these responsibilities had been delegated to the market in providing social services. And it didn't ultimately play out that way. So we're looking at strengthening the role of the state and at the same time strengthening healthcare and protecting the lives of our citizens. And this is done by strengthening the capacity of the system to respond, implementing plans where we manage these comprehensive systems, where we see we've increased cost efficiencies and profitability, but at the same time supporting the needs of our society. Our focus now is looking at more preventive emphasis, preventive medicine emphasis. So we have distributed the network throughout the entire country, working with the local communities so that we can address needs and do them in a timely fashion. We've developed a series of incentives so that we have transitioned from competition between the stakeholders, and we've been able to integrate these various triggers, and we are working in an affirmative fashion to strengthen governance as we manage the healthcare system based on articulation in the health jurisdictions. We have the Andalusian School of Public Health, working with Pan American Health Organization and the various ministries, and 11 subnational or local governments, 11 out of 32. Hopefully, we're going to ensure that all of the local governments will be able to be fully involved. So we're looking at the change management strategy focused on preparing the country to better address the transition to a guaranteed universal healthcare system based on the primary health initiative, working with the national as well as local authorities. We're moving also toward strengthening our strategic communication plans in this transition process to improve the performance of the healthcare system, strengthening the capabilities. And to do that, we first developed this diagnostic study to see exactly how we can promote these lines of effort, the ensuring greater access, distribution of our healthcare resources and talent, so that we can more meaningfully contribute to personal and professional development goals. So this key goal in our transition and evolution process, especially in the area of providing training and skills and competencies. We know that transformation starts with people, And we need to generate and accelerate change to expand to larger groups of professionals. Thanks to this virtual campus node from the Pan American Health Organization in Colombia, this has been a key support mechanism for implementing the strategy in training. And we have three key overarching projects. Over 8,000 people are now being trained in this ongoing program. We have what we know as the Accelerator Project, which we've discussed already, but also we're looking at strengthening competencies in primary healthcare, known also as educating our territories, where we're looking at this new stakeholder, the EPS, which has a high level of participation in the program. And we also have the territorial management in healthcare training program in Colombia. This is all going to be an important linchpin in accelerating the healthcare programs where we can ultimately assure the right to healthcare of all of our citizens. That's all I had. Thank you. Well, we'd like to thank the Vice Minister, Minister Parilla, just describing how the healthcare system in Colombia and the virtual campus is addressing many of the complexities and challenges in healthcare in that country. I would now like to offer the floor to Dr. Sandoval, Director of the National Institutes of Health of El Salvador, also working in the research in developing human resources and competencies. So there's been a signing of a new agreement with launching the virtual campus in El Salvador. Dr. Sandoval, we can now begin with your presentation. Good morning. Cordial greetings to everyone. So we're looking now at the El Salvador node with our public health virtual campus. It's a pleasure to address you this morning. So the experience of the campus has been very interesting. And thanks to the PAHO country office support, we created a team and we later signed in 2022 the proposed agreement. This was consolidated and we officially established the country node with the National Institute of Health of El Salvador. After legal and international relations consultations, the signing took place at the end of 2023, as was already mentioned, and we saw a combination of many multidisciplinary efforts that led to efforts by the Ministry of Public Health with its various and key components, just to mention the Directorate of Non-Communicable Diseases, Directorate of Epidemiology, National Directorate of the First Level of Healthcare, Medical Health Unit, and we also had local country representatives, VCPH regional team, Ministry of Education. We signed 8 cooperation agreements with various advanced studies centers and higher education institutions. All of these efforts were planned within the organization and with its efforts coordinating with the Ministry of Health, the Office of Knowledge Management was also a key component. So looking at the educational training needs, we conducted an in-depth study to determine exactly what they were. We actually had a survey distributed among 1,760 respondents. The training needs were focused mainly, according to the results, on administration and management of obstetric care. We identified gaps in training human resources in healthcare and services. It's also important to mention that as part of our efforts, we have the Public Health, Nutrition, and Research, INS 2023, developing competencies in nutrition research, and also addressing many gaps this year. And we have taught 2 courses related to writing scientific articles in the health sciences and publication in index journals in 2024, and hearts. These are some of the most successful strategies undertaken within the country. Now, projections at the VCPH node in El Salvador includes presentation of results, present scientific evidence of training needs to decision maker, generation of partnerships, in the building of courses appropriate to the country's needs, education networks to promote an education network for health professionals through the virtual campus, scientific publications, sharing experiences and methodologies through scientific publications, as well as course development efforts dealing with scientific communication, case reports, and narrative reviews, comprehensive mental health care for first levels of care, as well as those resulting from specific needs that we are exploring with these surveys. So thank you very much for your attention. We're very pleased to be a part of the process. Thank you, Minister Sandoval, and thank you for joining us today in this discussion. So we've seen the significant efforts undertaken by El Salvador in bringing together and articulating these efforts, as well as identifying some of the key needs in terms of training your human resources. Well, it's a pleasure. I'm very pleased with the support provided by the local PAHO country office in helping move forward with this initiative. Now we have Dr. Juan Francisco Bacibalupe from the Ministry of Health of Chile. And we have a video from the node that discusses exactly some of the characteristics of these efforts and initiatives.
Estimadas y estimados, es un honor dirigirme a ustedes como un ex coordinador, tutor y estudiante también de cursos del Campus Virtual de Salud Pública Nodo Chile. Una herramienta que desde su creación ha transformado la manera en que se capacita y fortalece las capacidades de los profesionales de la salud pública en nuestro país. Hoy, desde mi posición en el Ministerio de Salud, quiero destacar cómo esta plataforma ha permitido enfrentar los desafíos de nuestro sistema de salud, marcado por una alta rotación de profesionales, la necesidad constante de actualización y las crecientes demandas de una población en evolución. El Nodo Chile del Campus Virtual de Salud Pública ha demostrado ser un motor clave para el desarrollo de competencias en salud pública. Durante la pandemia del COVID-19, sobre todo, se consolidó como una plataforma de rápida adaptación a las necesidades de nuestro país. Se destaca por su accesibilidad universal y su enfoque en la equidad, eliminando barreras geográficas, económicas y sociales. Es una plataforma que no solo va a formar a los profesionales de la salud, sino que también los empodera, permitiendo que de todas las regiones de nuestro país, desde zonas súper aisladas hasta las más urbanas, puedan adquirir herramientas prácticas y teóricas para mejorar su desempeño. El campus virtual ha permitido algo fundamental: instalar capacidades de manera sostenible en un sistema de salud dinámico. A través de cursos personalizados y adaptados a cada realidad local, como los enfocados en salud intercultural o el modelo de atención integral, hemos podido responder a los desafíos de la salud pública con pertinencia cultural y técnica también. Considero que el Nodo Chile del Campus Virtual de Salud Pública tiene muchas potencialidades, pudiendo diversificar la oferta educativa con temáticas emergentes y de relevancia para la salud pública. El campus no solo es una herramienta educativa, es un pilar estratégico para construir un sistema de salud más robusto, equitativo y preparado para los desafíos del futuro. Desde mi experiencia, desde la docencia y la gestión, puedo afirmar que contar con una plataforma como esta no es solo un lujo, sino una necesidad para avanzar hacia un sistema de salud inclusivo y sostenible. Sigamos fortaleciendo esta red, sigamos fortaleciendo el campus Nodo Chile, porque invertir en formación es sin duda invertir en el bienestar de toda la población. Un gran saludo y muchas gracias.
Bueno, estos tres testimonios dan
Thank
cuenta
you.
de la diversidad de
So I think
habitación
the
y propuestas de
three
campus
speakers
situadas en países de la región.
have shown some of the
Para que puedan
major
responder a
efforts
las
undertaken
necesidades
in
de
the
salud
virtual
que
campus
cada uno
arena
tiene
throughout the
los que tenemos
area
en la región.
in the region. We
Bueno, a continuación
now
vamos a también tener
will
otro bloque de experiencias, pero en este caso
move
vamos a
on to
escuchar
discuss
experiencias
another
regionales
set of
de cooperación en
experiences
los
looking
niveles
at
de las
cooperation
instituciones socias.
in the
Laboratorio de
partner
Innovación Tecnológica
organizations.
en Salud
So
de la
starting off
Universidad Federal de Río
with
Grande del Norte en Brasil,
the
a través del video de su director,
Federal
Gustavo
University
Arana.
of Northern
La
Brazil,
Asociación de Escuelas y Programas
the
de Salud Pública de
Association
Estados
of
Unidos, ASCPH,
Schools
representada por
of
su
the United
presidenta, la
States.
doctora Laura Magaña,
We
y
have
de la
Dr. Laura
Universidad del
Magana,
Hospital Italiano de
and
Buenos Aires,
from the
Argentina,
Italian
en un video
Hospital
que el
of
rector
Buenos
honorario,
Aires.
doctor Marcelo Figavarela,
We'll
y correctora,
see
la
a
doctora
video
Marta Lavenheim,
that
relatan su experiencia de
discusses
cooperación con el campus
the
virtual. Vamos a
experiences in
comenzar
working in
escuchando el
cooperation with
video
the
de raíz, que
virtual
es el
campus. So let's
colaborador
begin with our
oficialmente.
first video.
Agradecemos al doctor
We'd like
Valentín
to
por grabar
thank
el video.
Dr.
Colegas del
Valentin
campus, por favor,
for providing
acompañarnos.
us with this
Ay, perdón,
initial
quiero saludar
virtual
especialmente a Juan
campus
Francisco, que veo que nos está
presentation.
acompañando aquí.
I know
Muchas gracias,
Francisco
Juan
has
Francisco,
joined
por el
us.
video de Chile.
Thank you, Francisco, for this video.
Olá a todos, eu sou Ricardo Valentim, diretor executivo do Laboratório de Inovação Tecnológica
I
e
am
Saúde
Ricardo
da
Valentim of the
Universidade
Innovation
Federal do Rio Grande do
Laboratory
Norte,
of the
centro
University
colaborador
of the
da
North.
OPAS OMS. O Laboratório de Inovação
This is a
Tecnológica em Saúde da
Technology
Universidade Federal do Rio Grande do
laboratory
Norte,
working
ele é
with
situado no Hospital
Northern Brazil.
Universitário Lofty
We
Lopes,
have our
em Natal,
University Hospital
Rio
in
Grande do
Natal
Norte,
and Rio Grande
que
do
fica
Norte
situado
that
na
is
região
located
nordeste do
in the
Brasil, uma região
northeastern
conhecida pelas
region
suas
of
belas
Brazil,
praias. Laís,
known for its
né, como nós
beautiful
chamamos,
beaches.
o Laboratório de Inovação
And
Tecnológica e Saúde, a sua
this
sigla
is
é Laís.
a
Ele
based
desenvolve
on its
pesquisas em diversas áreas
acronym,
no campo da
the
inovação e
University of
saúde.
Northern
Uma das
Brazil
principais
Laboratory.
áreas de
One of the
atuação do
key
laboratório
areas
é a
of effort
educação
in the
permanente em
laboratory
saúde.
is the
E
constant,
nestes
ongoing
trabalhos de pesquisa,
health
projetos que nós
education
temos
through
desenvolvidos nessa
projects,
área,
research
conseguimos
developed in that
desenvolver em
area.
2015,
We're
no ano
able
de
to
2015,
develop in
entre 2015 e
2015,
2016,
between
o ambiente
2015 and
virtual de
2016,
aprendizagem
a
do Sistema
virtual
Único de
learning
Saúde.
environment
Essa
in healthcare.
ferramenta
That
fantástica que
tool,
tem
which is
mais hoje,
fantastic,
atualmente,
that
tem mais de
currently has
1,3 milhões de
1.3
estudantes
million
em todas
students
as
from
regiões do Brasil
throughout
e
the
de algumas
region
regiões
in
do
Brazil
mundo,
and some regions around the world.
oferta
This
mais de
offers
430
more than
cursos, com mais
460
de 12
courses,
mil horas de cursos
more than
online.
12,000
A plataforma
online
AbraSUS, ela
hours
esteve
of
presente,
courses.
no Sistema
And
Único de Saúde
we have
em
a
grandes crises de
healthcare
saúde
course
pública. A
that
crise da
addresses many
microcefalia,
crises,
depois da Copa
including
do Mundo no ano de
microcephaly,
2014,
that we
na
saw
epidemia de
starting,
sífilis,
well, this started
e
with
mais
2014's
recentemente,
response.
durante a pandemia
And
de
during
COVID-19.
the
Nós fomos
pandemic
um
of
dos
COVID-19,
primeiros, grupos de
we
pesquisa
created
a
this
fazer uma
research
tradução de
team
curso da
where
OMS
we've been
na
able
época
to
da
provide
COVID-19
translation
para
to the
ofertar para todos os
course
brasileiros.
on
É por isso que
COVID-19
o ambiente
with
virtual
regards
de
to
aprendizagem do Sistema
emergent
Único de Saúde aqui no
virus,
Brasil é uma das principais
respiratory
ferramentas
viruses.
para a
So this is
indução
one
das
of the key
políticas
tools
públicas
that we
de
use in
saúde
promoting
no
public health
Brasil.
policies
Teria
in
muita coisa
Brazil.
para falar para vocês
There's a lot of
do
things we can
Laboratório de
discuss
Inovação Tecnológica e
regarding
Saúde.
the
Mas tenho certeza que
laboratories
vamos
in
ter outras
health innovations,
oportunidades
but I
e
think we'll have
afirmo que
other
posso garantir
opportunities,
para
and I can
vocês
assure
que
you
temos muito para
that we
contribuir
have
aí
a
com a
lot more
Academy,
to
juntamente com
contribute
os
with
outros
the
colegas dos outros
working
seis
with
colaboradores,
colleagues
e
from other
principalmente coordenado aí
institutions
pelo campus
and
virtual,
coordinating
liderado por
these
Isabel,
efforts
e
with
também
the
pelo Gabriel.
campus, with
Abraço a todos.
Gabriel and Isabel, and I'd just like to just convey warm greetings to all.
Agradecemos a los
Well,
colegas del
we
país
would
por el
like to
video.
thank
Bueno,
our
también porque
colleagues
estamos mostrando
from
a nuestros,
Brazil for that video.
a nuestros amigos de la OMS también nuestros bonitos
And
territorios que
we know
tenemos aquí
that
en la región.
we
Bueno,
have many other
ahora sí, paso a la
representatives
doctora
that
Laura
were
Magaña,
responsible for
quien es
that that we'd like
presidenta
to
de la
thank you as
ASCPH
well.
y de la Global
Now
Network
we're
of
going to
Academic
move
Public
on
Health.
to the
Laura,
Global
Laura,
Network
muchas
for
gracias
Public
por
Health.
estar
We'd like to
hoy con
thank you
nosotros.
for joining us.
Tienes la palabra, the floor is yours.
The floor is yours.
Isabel. I just want to say that it has been truly an honor and a great pleasure to partner with PAHO Virtual Campus during all these years in our shared commitment really to strengthen the public health workforce of the Americas. So thank you for having me here today. We have developed in collaboration, like really through innovative programs hosted, of course, in the virtual campus. Our partnership has made significant strides in building the region's health workforce, elevating public health capability, and modernizing the health systems. Through ASPPH, which is the Association of Schools of Programs of Public Health, which we have 160 schools with us here in the States, but in 7 other countries as well. But we also have the presidency of the Global Network. We represent more than 500 schools of public health around the world. So thank you for inviting us to be really partners of this endeavor. By uniting really our strengths, our organizations and these collaborations has equipped public health professionals with the skills to tackle critical health challenges and adapt to shifting public health priorities. So just for the time, I will just highlight 3 of our many initiatives that we have put together during all those years. First of all, I would like to talk a little bit about the ambitious program that we have that we call the Epidemiology in the Americas project to address the pressing need for local capacity building in applied epidemiology across the region. This collaboration focuses on strengthening the quantitative and analytical skills of health services and refining epidemiological practices. Central to this initiative is the creation of a 4-tier e-learning curriculum tailored to address varying levels of expertise: introductory, basic, intermediate, and advanced. The curriculum employs modular, self-paced learning to accommodate diverse learning needs and professional schedules. It equips public health professionals with hands-on skills in vital areas such as epidemiological methods, outbreak management, health surveillance, biostatistics, data science, and more. The Introduction of Epidemiology in the Americas course was launched in October 2022, is hosted in the campus, the virtual campus, and has been highly successful with more than 25,000 learners enrolled, and also 50% of them have already earned their certification, demonstrating both the demand for and the effectiveness of the course. The Basic Epidemiology for Health Systems in the Americas course is ready for release, and the intermediate course is under development. So this unique project is distinguished not only by its broad and bilingual accessibility, but also by its focus on applied epidemiology tailored to the diverse public health needs of the Americas. This initiative plays a crucial role in strengthening the region's epidemiological workforce, ensuring participants are well equipped to address current and future health challenges in their communities. Number 2, another initiative that I would like to highlight is a Telehealth Training Center initiative, hosted also on the virtual campus of public health from PAHO, focuses on integrating telehealth into primary care to drive the digital transformation of health systems across the Americas. Targeting critical areas such as the prevention, diagnosis, and treatment of non-communicable diseases, the program has achieved significant milestones. To date, the program has certified 33,000 Spanish-speaking professionals, showcasing its wide reach and impact. Leveraging simulation models, the initiative also builds resilience in post-pandemic healthcare systems, ensuring professionals are better equipped to meet evolving healthcare demands. To ensure high-quality telehealth services, we identify key competency domains for healthcare workers, including ethics, technology, public health, and socio-community aspects. These competencies are crucial for addressing health inequities in non-communicable disease care. Additionally, the virtual campus further supports telehealth professionals through self-assessment tools that help guide their ongoing professional development. And I would like to really end by the number 3, which we're very proud of, is our latest and inédit initiative, which is the regional framework of competencies for teaching public health. This ASPPH PAHO's virtual campus initiative brought together 123 academic institutions from the Americas, experts from 19 different countries, to develop this regional framework. The framework encompasses 10 domains and 40 competencies, meticulously crafted through 9 collaborative stages to standardize and elevate public health education across the region. Key achievements include 2023 publication of the framework and a pilot of its tool involving 145 educators from 56 institutions across 20 countries. This year, the framework was translated into English, French, and Portuguese, And a second pilot engaged at more than 1,000 educators from 81 institutions, also in 25 countries. So in addition, an academic network of over 100 professors from public health schools across the Americas has been established, providing an invaluable resource for the campus and fostering collaboration among educators. Future plans aim to establish a network of institutions to further advance and implement this transformative framework. This project marks a significant step in ensuring that our faculty and mentors are equipped to teach in competency-based models. Through these initiatives, we advance innovative public health solutions while fostering resilience and equity across the Americas. These efforts in epidemiology, telehealth, digital health, and teaching competencies have not only addressed demanding health challenges, but also reinforced the virtual campus mission to advance public health education, collaboration, and innovation across the Americas. By empowering public health professionals and fostering a culture of learning and adaptability, we are shaping a healthier, more equitable future for the region. So we celebrate the establishment of this current alliance between PAHO, Virtual Campus, and WH Academy. And just to reiterate that ASPPH and the Global Network, we are here ready to join you and partner with you in this endeavor to really strengthen the workforce of the Americas and the world. Thank you and congratulations.
Muchas gracias, Laura, por
Thank
destacar
you,
los
Laura,
puntos de trabajo y
for
convergencia
highlighting these
entre
points of work and the convergence between
Bueno, ahora para
the
finalizar,
virtual campus and the World
queremos
Academy. And to
hacer
end this
brevemente
block, we're going to hear the
palabras
video
de las autoridades
kindly
de la
sent to
Universidad
us by the
21 de Buenos Aires, que
Italian
están aquí
University
acompañando en esta
Hospital of
presentación.
Buenos Aires.
Por favor, equipo, iniciar el video.
Can you start the video, please?
Muy buenos días, soy Marcelo
Good
Figari,
morning.
rector
My
honorario de
name
la
is
Universidad
Marcelo
Hospital
Figari,
Italiano de
the
Buenos Aires.
honorary
Junto a
teacher
la
of
doctora
the
Roberta Ladena, mi
University Hospital
secretaria,
of Buenos
queremos
Aires.
hacer una breve
We want
presentación de
to
nuestra
make a brief
universidad, de
presentation
la
of our
relación con la
university and the
Organización
relationship with the
Mundial
Pan
de la
American
Salud.
Health
La
Organization.
Universidad Hospital Italiano de Buenos Aires, que
The
tiene hace
hospital
25
university
años,
in Buenos
tiene
Aires is over
una base
25
de
years
titulación en
with a
carrera integral de
broad
posgrado
basis in
y formación de especialistas en
graduate and
forma
postgraduate
continua.
courses and
Y
continuous
durante la
education.
pandemia, en octubre de
And during the
2020,
pandemic in
a través de un
October
acuerdo
2020,
logrado entre
through an
PAHO
agreement
y la
established between our
ISPS,
university and
logramos llevar
PAHO,
adelante un
we were
programa muy
able to
importante
implement an
de
important
educación basada en
program
plataformas
on
virtuales sobre el
virtual
campus virtual
platform-based education from
en
the
salud en la
virtual
UPS.
campus in health
Esa
of
primera
PAHO.
formación, que fue
That first
octubre
training
del
program, which is in
2020,
October
su nombre lo
2020,
dice todo, construir aviones
and
durante
the
el
name
vuelo,
speaks to it, to
trataba
build
de
a plane
ejemplificar
during the flight,
el desafío de la
trying to
gestión
give
institucional
an
en
example
el
of the
marco de la
challenge of the
pandemia. Contamos
institutional
para ello
management
con
during the
importantes
pandemic. We
colaboradores
had
como la doctora
important
Magaña,
collaborators like Dr.
muy
Magaña,
conocida por ustedes, la
very
Sociedad de
well
Escuelas y
known by all
Programas en
of you,
República,
from the Association of
con
Schools
sede en
and Public
Washington,
Health
y la doctora
Programs
Pilar
headquartered
Navarro
in
Pérez,
Washington,
de la Escuela
and Dr.
Andaluza de
Pilar
Salud
Navarro Perez from
Pública.
the Andaluza School
Se
of Public
concretó
Health.
un segundo encuentro
We
en
had then a
noviembre
second
del
meeting in
mismo año
November of that
con
same
el
year
tópico del triage en
with the topic
educación,
of triage in
donde tratábamos de
education,
analizar la toma de decisiones
trying to
tan
analyze
difíciles
decision
en momentos
makings,
de
which are
crisis y
so
de
difficult in
crisis.
times of crisis and
Nuestro acuerdo
post-crisis.
se concretó en
Our
noviembre
agreement
y se
was
reforzó
once
en febrero
again
del 2021
reinforced in February
con una
2021 with
segunda
a
carta de
second
acuerdo para el fortalecimiento de
memorandum
la
of
formación
understanding
docente en
to
entornos
talk
virtuales,
about training
orientado tanto a
of human
docentes del sector
resources
de la
in
educación y asesores de la OPS,
development
y se
and with
cristalizó
partners
básicamente en
from
dos
the
proyectos.
PAHO
Uno
people
que
with
fue la
two
elaboración de
projects, one which
materiales
was
de
the preparation of
autoevaluación para el
self-training materials
diseño e
for the design,
implementación de respuestas
implementation, and
educativas
evaluation of
virtuales,
education,
y el
virtual
segundo, un
education
curso de
proposals, and the
formación de
second,
líderes que la doctora
training of
Ladena
leaders, which
explicará.
Dr.
El
Lattingham will explain in a
primero de
minute.
esos proyectos
The first of the
fue
projects
de libre
is
disponibilidad a través del campus de la
free,
UPS,
available through the virtual
cuenta con
campus,
elementos que van
has
desde el
elements that
rol del tutor y
include the
facilitador de
role of the
educación,
tutor and
instrumentos de
facilitator in
evaluación,
education,
enseñanza y
evaluation
plataformas
instruments,
virtuales,
learning
elaboración de
through
programas
virtual
formativos
platforms,
y
training
aprovechamiento muy
programs,
efectivo
and
de
effective use
aplicaciones
of
educativas en todos sus
education
formatos.
applications in all
Le
formats.
voy a pedir a la doctora
I'd
Ladenham
like to
que
ask
cuente
Dr.
nuestra
Ladenham to talk to
experiencia
us about our
positiva
experience
con el curso de liderazgo.
with the
Doctora.
leadership course. Doctor? Thank you, Marcelo. Yes, the second course, as he mentioned, was a course for educational management in health organization, developed for 2 years, including a meeting with leaders from the region to think of the need to train in leadership and manager required by those who lead education in our region at this time. And we thought that this type of management and leadership courses were so important because they face changing and complex situations, and they require space to think about the possible practices using the available theory frameworks. And it's important for us to have a network. That's why it was geared to those who do this type of work in different environments. We had a group of professionals from different countries, Argentina, Uruguay, Colombia, and Brazil. And with the presence of participants from 19 countries of Latin America and the Caribbean. It was a very, very interesting course, and it had a great deal of discussion. Proposal was a completely versatile proposal with synchronic and asynchronous opportunities, proposing at all times recovery of the experience using a conceptual framework to favor the collaborative work, generating a portfolio where each participant spoke of his own experiences and how these were changed within their own context and based on a theoretical framework, where throughout the course we developed the different domains of leadership in education. And we want to share that we recently participated in a workshop prepared by the Virtual Public Health Campus in Panama, working on the management of educational quality, showing our commitment to continue to work with the campus, not only in the development of quality proposals, but in building the actual criteria required for educational quality in the region and what are the challenges to reach this and to ensure it. Thank you very much. Thank you, Roberta. And we believe that this clearly shows our joint commitment with PAHO. Thank you.
Marcelo, Roberta, muchas gracias a ustedes y al equipo.
Marcelo and Roberta, thank you very much for your presentation and your work. I think that these two presentations show the variety of the virtual campus and on permanent education and lifelong education and the training of public health actors. It's a proof of the quality of the organizations in our region. And the last presentation for this group, it's a little late, but we thank you for your patience. We are going to listen Javier Litowski and Charina regarding the plans for the future and things that are already developing within the framework of this promising agreement.
Gabriel, David, thank you. And in the interest of time, I'm going to try to be quick. Here, as you can see, there's a series of bullet points that reflect the agreements that have already been signed and cooperation mechanisms in the following areas. We're looking at the development of outputs and products with special emphasis on regional academic institutions in Spanish and Portuguese to ensure interoperability among the platforms so that health workers in the region will be able to freely circulate between platforms. Also providing mutual recognition and accreditation for emergency medicine responses, working together, as was already shown in the Italian hospital example, to provide tutoring opportunities and virtual training. So this is the learning pathway that we're embarking on jointly. And let's take a look at some efforts that are already in progress. Dr. Anchorena talked about the quality standards. We have the virtual campus working actively with the support of the WHO Academy aimed at quality standards promotion, and we've also seen focus on these gateway to PAHO courses so that we're able to present within the WHO Academy some of the core courses offered by PAHO. We see how the organization's campus maintains a presence in this gateway developed jointly with the technical staff from the WHO. We're going to continue these collaborative efforts with the three institutions that have already given presentations this morning. And in 2025, we hope that we will be able to work together with both technical teams. Dr. Serena, if you would like to add anything to this.
David, you are here?
Sí, muchas gracias, Gabriel. Thank you very much for those points, reflecting really the consensus and the convergence of forces between the PAHO Virtual Campus and the WHO Academy. I would like to stress the fact that the basic principles that provide the foundation for the work of the PAHO Virtual Campus are very similar to the ones that guide really the work of the WHO Academy. Open access, providing and developing a global public good. I mean, those are the fundamental principles also that the WHO Academy intends to serve. Building learning pathways for health workers and providing a quality assured framework that will also allow for certification, recognition of learning, including through the issuing of digital badges. So, I mean, a lot of the work that has been already conducted by the virtual campus will be, I would say, further reinforced, but will also guide the activities of the WHO Academy. So partnerships for us is a key word, and we are really very pleased to have been able to develop this constructive, really, framework with the PAHO virtual campus. And through that, we will be able also to link with a number of institutions in the region. Some of them have actually already expressed their experience today. And we are looking forward to also develop partnerships with more. In terms of a collaboration with member states, I think that the models that have been established through the so-called NODES and Chile and El Salvador, they also provide a very interesting model in terms of collaboration with member states, not only to expand access to learning, but also to contextualize content. And I think that the work for localization that the WHO Academy will put in place will also, be a very important instrument to ensure the relevance of delivery. And with the help and support of the virtual campus, we will also ensure that the WHO Academy will further provide, I would say, relevant content that will actually add to what is already available on the virtual campus. So I'm very pleased, and I'm sure that with this collaboration, we'll be able to actually further reinforce really, access to lifelong learning in the region, in the health sector, in a way that will support countries in the achievement of their policy goals to provide global health for all and to provide universal health coverage. Thanks again, and again, we are very much looking forward now to the implementation of this framework with the virtual campus, with member states in the region, and with partner institutions.
Muchas gracias a ambos. Bueno, hemos llegado al final, hemos realizado
Thanks to both of you. We have made a real overview of all the institutions and the possibilities that we have to strengthen this agreement. So thank you to all of you. And to end this webinar, I would like to give the floor once again to Dr. James Fitzgerald. James?
Thank you. Thank you so much, Isabel. Many thanks to you for moderating what has really been an amazing session. Over the last hour, I think we've really heard of the great work that is ongoing through WHO Academy and through the PAHO Virtual Campus. And what we've really seen, I think, is the importance of online education platforms in developing the necessary capacity within health systems in our countries, from Colombia, from a substantive health sector reform process, to El Salvador through capacity building in multidisciplinary needs, and management and administration, as well as quality improvement processes and clinical service delivery. Chile in public health capacities during COVID-19, and indeed from our wonderful partners in Brazil with Avasus, with Laura, with the ASPPH, and key universities such as the Universidad Hospital Italiano de Buenos Aires. No? So, David, we're really excited to join forces with you, WHO Academy, to take, as our Assistant Director, Dr. Celia Thomas noted, education and training of the health workforce in the Americas to a whole other level. Jointly with WHO, we commit to expand capacity and increase the knowledge base in the Americas to respond to current and future needs of the health workforce and of the population. So my thanks to you, David, and all your team in WHO. My thanks to you, Gabrielle, and all the team at the virtual campus. We're really excited for this collaboration. We hope everyone connected here will continue to join us on this journey. And we look forward to keeping you all informed of the advances we will be making as we move forward with implementation. Isabel, many thanks to you again. My thanks and regards. A good day to you all. Bye-bye.